So good evening. I'm Dr. Eman Hamza, the chair of the Bahrain subgroup Alumni. I graduated from RCSI MUB in 2011. I currently hold the position of a senior registrar in general surgery at King Hamad University Hospital, and I'm honored to chair this event. RCSI Dublin, RCSI Bahrain would like to extend a warm welcome to all our guests who registered to the first series of our Alumni event. Our speaker today is an important icon regionally. Please allow me to introduce Lieutenant Colonel Professor Manaf Mohammed Alqahtani. Prof. Alqahtani is a North America double qualified internist in infectious disease and a clinical microbiologist. He is a physician currently working as infectious disease and medical microbiology consultant at the Royal Medical Service of Bahrain Defense Force. He is the head of Infection Control Unit. He is a professor of medicine and principal investigator at the RCSI MUB. He graduated from RCSI Ireland in 1999 with distinction honors. Prof. Alqahtani was awarded in 2017 the First Class Medal of Competence, and in 2021, Prince Salman bin Hamad Medal for Medical Merit by His Majesty King of Bahrain for his achievements in the healthcare of the kingdom. He is an editor in well-respected journals and peer-reviewed over 45 publications. He contributed to the health guidance and recommendation to the WHO. There is no doubt that we will all gain knowledge from his valuable presentation discussing Bahrain's national COVID-19 battling effort. Prof. Manaf Alqahtani, we welcome you.
All right, thank you very much, Dr. Eman, for your generous introduction. I'm very delighted to be the first speaker in this event, and I'm very delighted also to kind of share with you the Bahrain efforts against COVID-19. I do understand it has been almost now 2.5 years going through this pandemic in the modern arena of the pandemic. There are some learning lessons that I would like to share with you before I start my presentation. I always like to start with some take-home messages, and then I'm going to dive into my slides. So the first thing is I'm going to explore the efforts of Bahrain in containing COVID-19. Bahrain is a small island of 1.4 million of population, and we know as an epidemiologist, when it comes for a pandemic, an island always going to be at risk of having massive casualties. So we really had to start earlier on, even before the first case, which was in February 26, 2020. So we started preparing ourselves exactly in January 15, 2020. Unfortunately, the pandemic is not over yet. Everyone is fatigued and tired, and we wish that we have this good news to say the pandemic is over. We have not even reached the endemic stage yet. However, there are certain elements that I believe are important to set the scene, to prepare ourselves to move in from the pandemic to the endemic. And lastly, I'm going to share with you some research that has been contributed by RCSI faculty and students, where we have used them as a data-driven policies for the Kingdom of Bahrain. Most of our local protocol has been driven by local data. And again, one key learning lesson here is when it comes for the pandemic, the first thing when we become aware of SARS-CoV-2, we had very limited information about this virus when it comes from the dynamics, clinical presentation, and even from the therapeutic. And when it comes in a pandemic, if you're going to wait for other people to publish or even to guide you into this pandemic, it's going to be too late. So this is where you have to start earlier on and build up your data and build up your research and try to come up with the best tools that you have to fight this pandemic. And this is going to be really the overall summary of my presentation. Next slide. It's, I think, important to give you an overview of the Bahrain situation when it comes for the pandemic, and I try to summarize the important aspect here. So those are this slide has been prepared a few days ago, so I'm going to just give you really the real updated information. So in Bahrain, we have a control command room consists of 15 people. We used to be 45 during the early pandemic, where they work 24 hours a day, and they provide a live data and dashboard to the policymakers and decision makers. So as of today, we have around 8,000 active cases of COVID-19. 99.5% of those are actually been in home isolation, and only 0.4 to 0.5% has been admitted, which is completely different when I'm going to talk about the different waves. For example, when we had the Alpha and the Delta. So you can nearly say, if we are 1.4, 1.5 billion, you can nearly say that 36% of the Bahraini population, at least they got one episode of infection. And again, I know one of the hot topics is reinfection, so I have some local data about reinfection among different variants. Even though, as I said, when Bahrain becomes a very small island, we really maintain our recovery. So it's beyond 97%. We have recovery rate 99.7%, and unfortunately, we in any pandemic you're going to have some people losing their lives. But again, fortunately for the Bahrain, we did not have this massive casualty. So the amount of the people who died around 1,400. So that's roughly around 0.3%. Currently, as I said, we have only 44 active cases being hospitalized, and we have only 6 people being in ICU and only 3 people being intubated. The majority of the cases currently are among those who are unvaccinated or unboosted, and the average age is around 75 years of age. One of the key tools that really had to prepare the community of Bahrain is actually the vaccination. So I'm happy to say that the vaccine rate of the Kingdom Bahrain, of the entire population, is nearly around or close to 81%. And of those who have received 2 doses, which is the 81%, 85% have been already boosted from those who are vaccinated and are eligible for the additional dose. And again, I'm going to really speak very briefly when I come to the vaccine about the rationale behind the additional dose and why do you think additional doses, or people sometimes call them booster doses, are important. Next slide. There are 4 major achievements that I consider them very important. And if anyone would ask me what would be the 4 key things you're going to work in any upcoming pandemic, I'm going to say number 1 would be testing. Testing is the key tools when it comes for prevention, cutting the cycle, the transmission of the emerging infection, especially when you have a virus that's the R naught of it exceeds beyond 3. Omicron actually, it's the R naught, which is the rate of transmission of the virus, is close to 6, and measles is around 8 to 12. So it is a very contagious, unfortunately, virus, and from different variants, we have seen different dynamic of the transmission. So what are the key methods when it comes for the testing? So there are 2 key testing. So if you want to make a clinical diagnosis, then the real-time PCR would be the key. And if you want to use a public health tool in preventing or in identifying those who are infectious, then the antigen test. Bahrain has an early on experience when it comes for the antigen test back in August 2020, when we have introduced the antigen test among different entities, and then later on in the community, which I'm going to talk about it. So testing is a real investment. I do remember when I had the first encounter to secure number of kits for the real-time PCR. Germany was the biggest country manufacturing the initial kit, won't say the name for it. But I remember I asked for 50,000 kits, and that was back in January 15. And the email that I got from them, they say, are you going to deal with it in a biological weapon? So again, at that time, people underestimated the key of testing, and I think we all realize testing has been the landmark in handling the pandemic. Treatment. Believe it or not, we have established 7,000 beds dedicated for COVID-19. Of those 7,500 highly equipped ICU. They're completely separated than the non-COVID hospital. And again, we learned from MERS-CoV, we learned from SARS that hospital transmission going to be a key. And I think we have seen and we have witnessed during the entire pandemic that hospital transmission has been another anxiety driven for the healthcare worker. So you have to set up whether if you have the capacity, an entire institutions for COVID or units that should be fully dedicated for COVID-19 and should not interfere with the non-COVID. And that's a key thing. The life has to continue for the non-COVID medical care. Vaccine, again, I'm going to spend one slide on the vaccine, but with all the news comes along with the vaccine, the only way to end the pandemic and to go into the endemic is actually by having the immunity from the vaccine. What's the difference between the natural immunity versus the vaccine immunity? Unfortunately, you're taking a risk when you acquire the natural immunity from the infection. There's always a risk when it comes from the infection. So either you get the live virus, and then depending on your immune response, how then respond. We learned from the SARS-CoV-2, it has the biphasic illness, it has the viremia, which is the fever, the fatigue, and then it has the inflammatory, which is a proportion of the people, unfortunately, goes into the post-inflammatory phase where you have high cytokines, where you have all the complication, and you have the multi-systemic organic failure, which kind of resemble the initial SARS-CoV-1, which we call it SARS. And the last thing would be is a tracking application. In Bahrain, we have a local developed application called the Be Aware, and that can track all the active cases. And it's a 24-hour service. You can upload your antigen test. You can file a complaint, for example, if you did not get an appointment for the vaccine or an appointment for a test. So a Be Aware it's basically has been the landmark application where people even forgot. For example, in Bahrain we have the 999, which is the usual care you receive in emergency, and then we had the 444 and the Be Aware. So during the pandemic, people completely forgot about the 999, and if they have any problems, even if non-COVID, if you have fire problems, they would call 444, or they're gonna deal with the Be Aware. Next slide. We invested in the Bahrain Protocol. It's around 120 pages. All of it is locally designed from the Bahraini data. Again, we emphasize on testing and tracing. As of today, we had over 890,000 people that has been traced and contacted, and the positivity rate around 17 to 22%. Treatment, again, today we have roughly around 400 empty beds. Of those 470 beds, we have only, as I say, 44 occupying them. And from the 400, we have roughly 250 ICU beds, and we have only 6 been occupying. Again, I'm going to show you the differences between the variants when it comes from hospitalization and the infection rate. And the traffic light, which I'm going to spend, if you go to the next slide, please. The traffic light system, it's a new model or a new tool that we have developed in Bahrain. We started that in May 2021 when we had the surge of the Delta. It's basically, it's give you a guidance. It's engaging the community with the policy making here in Bahrain. So during the early pandemic, people have left in the dark where they said, when are you going to do the restriction? When are you going to do the mini lockdown or the major lockdown? Business sectors has been a big element that's been affected by this. So if you engage the community and if you engage the schools, the education, in knowing at which level we are running. So red means it's a lockdown, and green means everything is beautiful, whether you are vaccinated or non-vaccinated. Orange and yellow, life is beautiful if you are vaccinated, but life is not very beautiful if you're not vaccinated. So again, we had to put some incentive for vaccines. We had to engage the community, and this is, as I said, it's a live dashboard launched in the Ministry of Health website. People would know exactly which level are we in. And if you want to move in, let's say from the green, which we are currently now, to the, let's say, red, then it's up to the community. You know, just go out, remove your mask, do all this unacceptable behavior during the pandemic, and you're going to go to the red if you want. So it was the whole idea just to engage the community with us and gain the public trust, and it worked perfect for us. So initially we had to depend on the rolling average of the newly active cases, but then when had the tools, and again, that's a very important, when we had the vaccine rate above 70%, when we had the booster dose above 50%, and when we had the beds are empty, and we had all the treatment and therapeutic for COVID-19, this is where we have shifted, for example, now into rolling average of the percentage of people occupy, or the patient or the cases occupying of the ICU. So, so to remain in the green, we should have less than 50 cases in the ICU over the last 14 days. If you want to go for example, to the, I can't see the star, but if you want to go to red, then we had to have more than 200 ICU cases occupying the beds. So again, it's we are tailoring this based on the situation. And as I said, as of today, we are currently on the green, and we are updating this traffic light where we had the white zone. White zone, it's an intermediate phase before you go to the normal. So green zone does not mean completely normal, because in a green zone means you should still have mask on during indoors, but everything else is completely back to your usual life. Next slide. The ongoing mitigation, that's still ongoing until now. So we're still meeting. We used to meet every day between the key members of the National Task Force. Now we meet once a week. And again, the whole point of this, we have the key people, we have the leaders, the decision maker, where we share all the concerns from the clinical perspective. So you have almost 15 members from public health, from the Ministry of Health, from the Ministry of Interior, from the education sector, different sectors from the Bahrain community, where we have this dialogue and engaging about the current situation. Other than that, the vaccine is still ongoing. Bahrain ranked number 6 or 8 now worldwide in terms of the vaccine per capita. The only restriction that we have right now in Bahrain is wearing masks indoors, but other than that, everything has been relaxed. And we're going to talk about when we're going to remove the mask in the next few slides. Next slide. I think it's important for me to just spend 1 minute on the national vaccine program. As you know, when it comes to the vaccine, especially for a new vaccine, and especially in Bahrain, and for adults as well, because most of the vaccine program are for children. You need to prepare the community about it. And I think the first thing we have done, and I think that was the most wonderful thing that I think we have done it, is actually to be enrolled with the randomized trial. So we have set up a randomized control trial along with China and UAE, where we have the inactivated vaccine. And the whole idea, we wanted to test the ability of the Bahrain community to take the vaccine, and we have enrolled in 6 weeks more than 7,800 volunteers, and we have followed up with them. And that's one of the reasons why people felt very comfortable with the inactivated vaccine, which is the Sinopharm, due to the fact that we have enrolled the trial in the kingdom. Other than that, we had 31 centers that can accommodate up to 23,000 individuals to get the vaccine. People of Bahrain can make an appointment and get the vaccine within 24 hours. Most of the vaccine centers being equipped by professional registered nurses. We had to train other people in a very short time, but as I said, 31 centers, including to the mobile unit that we had to go to some nursing home or for elderly at home, where we provide them the vaccine and the care as well. Next slide. One of the key things when it comes for the vaccination, whom should you vaccinate? Again, people get this concept is wrong. It's not, we're not just offering the vaccine haphazard. You really need to target your population, and this is what we did when it comes we offer the vaccine. So we have targeted our elderly population. So in Europe, again, based on age definition, even though I don't believe that you are all above the age of 60, but if you are 65 and above, you are along the category of elderly. In Bahrain, we have really reduced to 50 because of the comorbidities when it comes for obesity and the other metabolic. So we have really reached up to 81% of those who are high risk to be vaccinated, and now 81% to be boosted. And then you can see from this slide, we have succeeded to vaccinate the majority of the population. Those who are 3 to 11, roughly around 13.7% has been vaccinated. Again, there are lots of hesitancy when it comes from the parent, but when it comes for the age 12 to 17, 91%, and I think that's a great rate to have for this age population. And guess what? The majority of the cases, whether it's in Bahrain or nationwide, when it comes for the infection, is among those who are highly mobile and young generation, and that they can transmit the virus quite easily. So I think the key message here is first, secure the vaccine for the elderly because the mortality is very high, then secure for the mobile and highly mobile individual to make sure that you cut down or at least reduce the cycle of transmission. Next slide. This is the thing I think everyone would like to know about, is how, at least from the Bahrain situation, and I think we are not too far from the rest of the countries. So along with the testing, we have been doing gene sequencing since June 2020. More than 26,000 sample has been gene sequenced. And I think in this slide, it just briefly tells you about the difference between Alpha and Delta and Omicron. So just let's get the color right. Alpha is the golden color and Delta is the gray color. You need to remember this because we're going to use it for the next 3 slides. And the maroon color or the red color is the Omicron. What can you see here? By far, Omicron has been the most transmissible virus. Can you believe it that in one day we had over 8,000 of cases? Again, for a population of 1.4 million, that's quite significant. We reached that peak in 6 weeks, whereas in Alpha we reached the peak of around 1,300 over 2 months. And when you compare to the Delta, less than 2 months, we have reached roughly around 3,200 cases. So those just give you the differences between the variants when it comes for the daily newly active cases. In the next slide, we're going to look at the active hospitalization, and we're going to compare it with the different variants. So if you can move to the next slide. Perfect. So again, here things are different. So remember, Alpha, that was way back in April 2021. The vaccination rate in Bahrain, and I think in the most of the world, was not really above 30%. So, and that's why you're going to see there are many cases when it comes for the Alpha. And then when it comes Delta, again, back in June, we have reached our vaccine level, 2 doses of the vaccine, roughly around 35 to 40%. And that's why you see more and more cases when it comes with the Delta. However, vice versa when it comes for Omicron, even though we had the highest rate of nearly daily cases, and it is the most transmissible virus or variant, and yet the hospitalization has been at the lowest level. Now, why is this? It's a combination. Number one, we have a community that has been immunized above 80%, and of course you have a proportion of the people that also get naturally infected. So you would say 90% of the people have the herd immunity, and that has kept the momentum. The question is how long you're going to reach. You're going to keep that level. Now, just a very quick immunology recap. To keep the rate of hospitalization at the lowest level, you need your B cells and T cell memory cells. And this is where it comes the effect of the vaccine. When you receive the 2 doses and the additional dose, which is the 3rd dose, you are up to 87% of your T cell to prevent severe illness and death. And you know what? And that's what we have seen when it comes with the Omicron. Even with the big surge, our death has been the lowest in comparison to the Delta and the Alpha. And that's what we're going to see on the next slide, When we're going to look at the ICU cases, because ICU can be your predictor for the mortality. And again, gray is for Delta, and we had the highest ICU case, almost 56% of the bed occupancy back then in May and June 2021 was due to the Delta. If you compare it to the Alpha and to the Omicron, again, Omicron has been the lowest, which is the maroon color. Again, that's all in keeping and the success of one of the biggest important tool, which is the vaccine. And on the next slide, when it comes for the death, as I say, unfortunately, when it comes for the pandemic, we're going to lose life no matter what strict measure you have, but you want to minimize the damage or the loss of life. Again, if you compare Delta versus Omicron versus Alpha, Delta was the highest, then Alpha, and then the least comes with the Omicron. Now again, that's another a very positive marker for the effectiveness of the vaccine. If you move on to the next slide, here I want just to highlight about the 1,300 cases mortality. Now in Bahrain, we have 4 platforms of the vaccine. So we have the inactivated vaccine, which is the Sinopharm. We have the AstraZeneca, which is the viral vector, and we have the messenger mRNA, which is Pfizer, BioNTech, and we have another viral vector, which is Sputnik, which is the Russian vaccine. One of the key things and things that if you are from medical background, you understand when it comes to the inactivated vaccine, the efficacy for preventing severe disease in elderly would be not less. And where do we come from this data? The influenza. Even with the vaccine, with the vaccination, we have seen, unfortunately, you're still gonna get some mortality when it comes for hospitalization and death post-influenza infection. And that's our learning message. When we had the 187 deaths and those who were vaccinated, the majority were among those who had the Delta variant, and they had the 2 doses of the inactivated vaccine, and they had also comorbidity. More than 65% of those had above the age of 65 had also comorbidities. But as I said, with the Omicron, we have the lowest. So in a month, we get 2 to 3 deaths, and all of them actually are among unvaccinated, and the average is around 75. So you can say that we are going into this endemic phase, but when you have the rest of the world still the vaccine rate about 53%, and you have this new emerging of the variant, which we're gonna have new variant, and that's not a secret. This is where we say we are not yet into the endemic, but we are moving into this endemic phase. Next slide. Actually, you can go to the next slide as well, where I'm going to talk about the effectiveness of COVID-19 measures. So again, just to illustrate the lines. So when it comes for the green color, that's indicate the fully vaccinated, and you can see from the early the 3 waves, the Alpha, Delta, and Omicron. When we are at 30% of the vaccine, which is the yellow line, we had more cases, we had more hospitalization, and when we improve our green line, which is the vaccine, we had more cases, which is the breakthrough infection, but we had the lowest when it comes for hospitalization and the lowest of death. And again, that's a good positive tool that we have used in understanding the pandemic situation in Bahrain. All right, next slide. The most hot topic, reinfection. And actually, I have just gathered some new data. This is the slide I prepared from 5 days. Now, reinfection. So there are 3 definitions. There are 3 categories to put you at reinfection classification. So number 1, if you get 2 different episodes of infection more than 3 months apart, this is as per CDC and WHO, it's considered to be suspected reinfection. If you if your initial infection was asymptomatic or mild symptomatic, and your second infection was hospitalization or severe illness, that's considered to be suspected reinfection. Confirmed reinfection is when you do the gene sequencing. So in Bahrain, we have roughly around 31,000 that we have followed to be classified under suspected reinfection. Of those 31,000, we have done gene sequencing, and we confirmed 676 to be reinfected. Now, when it comes for Omicron, and again, this is a very interesting, majority are vaccinated. You will get some, and again, vaccine tool is not to prevent infection, was designed, again, that was a communication error. People felt, or people hoped that vaccine will prevent infection. In any respiratory viruses, it's nearly impossible to have a vaccine that will prevent 100% infection. But the key things we want from the vaccine is to minimize hospitalization and to minimize the mortality. So from the in February, for example, which was the majority of the reinfection, and 100% were from Omicron. And believe it or not, I had 9 cases that they got reinfected within 12 days, and they have completely different variants. So they had the BA1 and which is one of the sublineages of Omicron, and on the next episode they had the BA2, which is the most dominant variant in Bahrain and worldwide in their second episode. So when it comes for the reinfection from the Bahrain data, I can say 64% from the overall of the 676 are Omicron. Just imagine, within only 2 months. When it comes for the Delta, it's 27, and we had Delta for nearly 5 to 6 months. The last case we had with Delta was in December 5th, 2021, and only 5% from the reinfection comes with Alpha. What's the key message from this slide? Is the immune evasiveness of Omicron. You know what? SARS-CoV-2 or COVID-19 virus wants to survive, and the only way it can survive is to evade our immune system, whether it's a natural acquired or by vaccine acquired, and it has the ability to cause breakthrough infection. Next slide. It give you the illustration of the 676 cases. As I said, we had nearly 134 cases, less than 3 months confirmed to be reinfected. Those were all unvaccinated. Again, unvaccinated put you at high risk of reinfection. But when it comes with Omicron, whether you're vaccinated or unvaccinated, reinfection is almost similar because of the ability to evade the immune system, whether it's acquired from the natural infection or acquired from the vaccine. The good news about it when it comes for the reinfection, if you are vaccinated or naturally infected, is your risk of being hospitalized is much less. And again, one reminder, which one is better to get the natural infection versus the vaccine? For those who are still hesitant about the vaccine, just think about it. With every single episode of infection, you are taking a risk of your immune response, and whereas with the vaccine, it is only a measurable amount of the viral protein that you provide, that is not live, that can produce that can trigger your antibodies and your T cells. Next slide. And actually, I think you can move to the next slide as well, just for the sake of the time. For those who are interested to know which categories have we done gene sequencing, so we have different varieties. So we have done random just basically where we want to see any new emerging variant. We also have covered post-vaccine to look at immune evasiveness, traveler, reinfection, admitted to the ICU, and death. And again, I feel very proud that Bahrain has the capacity to be pioneering, and we have actually had several collaboration with Harvard University when it comes for gene sequencing. And I'm very pleased to say very soon we're going to have a joint publication about Bahrain variant analysis when it comes during the COVID-19 pandemic. Next slide. This is just to give you an overview of all the variants since the beginning of gene sequencing, which is June 2020 until today, March 2022. And the blue colors is the Delta, and you can see how Delta has been replaced completely by the Omicron in no time. So, and again, this is very true in the most of the world. Omicron, and to be more specific, BA2 and BA1 is the most predominant. So there's the original Omicron, then we had the sublineage BA1, and then we had the BA2. And this is just the nature of the virus. Virus try to compete with our host to survive, and this is how it get mutated and produce the variant. Next slide. One of the beautiful lesson about gene sequencing is actually just give you the trend of the mutation of the virus. So in December, when we had the majority or the beginning of Delta, so blue color is the original Delta, which is the B11529, and then the golden dark is the BA is the BA2, and the lighter one is the BA1. What's the take-home message from this slide is when it comes to March, you will see that the BA1 and BA2 replaced the origin of Omicron, but we are seeing that the origin, which is the B11529, is coming up, which is the blue color if you compare it to February and January. Next slide. I'm going to just wrap up here very briefly. One of the things also we have done in Bahrain is we focused on the next phase of the pandemic, outpatient therapy. So if you go to the next slide, here we have used the monoclonal antibodies. So initially we have used the bamlanivimab, and then we shifted to the region COV, and then we used the sotrovimab. And again, the reason why we have shifted from one monoclonal to another one is because of the emergence of the variants. As you all know, Omicron has been proven to be less effective when it comes for bamlanivimab and region COV. However, when it comes for sotrovimab still can withhold and can neutralize the virus. We have really a good success utility. We have a strict criteria. It's a 1 hour or 45 minutes infusion where patient comes in, usually the higher risk, the elderly, or those who have comorbidity, and 97% from the recent record that has not been hospitalized after receiving the monoclonal. Had they not getting the monoclonal, there was a risk of being admitted when we compare it with the control during the Delta wave. Next slide it's the trial that we have done for the sotrovimab. So we have used it. If you go to the next slide, Laura. Yes. So initially we have used it for outpatient. Currently, because of the limited supply, we have used the sotrovimab for inpatient, those who are on less than 6 liters of oxygen. And again, we have given to those who are average age 75, higher risk people. Majority are maybe unvaccinated. And from the 100 cases, 78% has been on oxygen, and then has been discharged home without oxygen. And again, that's one of the tools, and I say that you should have to say whether you are beyond the pandemic and you're moving to the endemic. And the keyword here is to minimize your hospitalization and death. And next slide is maybe heard of the Paxlovid. That's the Pfizer pill. Again, we launched this a couple of months ago. We have roughly around more than 1,100 people who receive Paxlovid. One of the beauty of the Paxlovid is actually it reduces the viral load. So we have done a small pilot where we have measured we have done their viral their PCR, and we have measured the viral load. at day 3 and day 5 from receiving the Paxlovid. Paxlovid, it's a 3 pills twice a day for 5 days, and majority actually turned negative on day 3 and day 5 as well. So it reduces your viral load, and again, that's one of the mechanisms that we knew about the antivirals. It will minimize or it will prevent the attachment of the virus to the cell, and therefore it will prevent the pneumonias. And again, Paxlovid has been very well tolerated, but it has lots of drug interaction, and that's why we have clinical pharmacists on board to check and cross-check for drug interaction. All right, nearly almost there. So if you go to the next slide, and again, next slide as well. Things that I have personally learned from this pandemic are the following points. Number one is that the human behavior is always linked to the behavior of the virus, and that's one of the key things that we have to remember. If we misbehave and remove the masks, don't take the vaccine, no social distance, the virus is going to take this opportunity to infect, and unfortunately going to go to the most vulnerable, and then you're going to have the cycle of transmission among individuals in the community. Second is the importance of utilization of testing, and again, you have to use the innovation. Antigen test, for example, is an excellent public health tool, whereas real-time PCR is an excellent clinical decision tool. And I'm going to show you one slide about how successful was the antigen test. The willingness to consider new ideas, and this is the key message for antigen test. It was nearly impossible to think that our community, they're going to do the self-testing. You know, it has been 2 years. Most of the healthcare workers get fatigued from testing. So we really wanted to share, we really want to delegate now, or to kind of take or give the responsibility for the community to do their own testing. And again, antigen test has been the right tool for home-based tests. And finally, which is the most important, how can you balance the safety of economic, education, well-being, and maintain the freedom and personal freedom of choice? And I think that's a very important step when it comes during any pandemic. And the next slide, very quickly, about the use of antigen tests. By now, we have used over 2 million antigen tests. The initial 1 million, we've used it during this pilot studies, started from August 2020 until February 2021. We have used it in the public and private schools, sport teams, events, hospital, ER, health center, healthcare worker, and screening in the community. So as I said, we have prepared all of this for one thing is to kind of educate our community in how to do self-test. And I think we have succeeded when it comes for the antigen test. Today, for example, the majority of the cases are coming from antigen tests. We still do the real-time PCR for counting the cases. We still rely on the real-time PCR. So if you have positive antigen tests, you should confirm it with the real-time PCR. This is just for counting. But 59% of daily new cases being discovered by antigen test. Next slide. You can just go to the next slide as well, just for the sake of the time. Next slide as well. Multi-layered approach is the key thing here. And what do I mean by the multi-layers is when you have all the different tools, testing, contact tracing, vaccine, and other tools to kind of have on board to fight this pandemic. And the last two slides, if you go to the next slide, remember when I said we have really engaged most of our students and RCSI faculty. So I'm very proud to say over the last 2 years, we have produced 21 publications when it comes from local data, and it covers all different aspects from epidemiology, diagnostic, clinical trial, clinical and treatment, vaccine, and we have written 2 recommendations with WHO for aviation and maritime. And again, the idea that is data clearly will play a vital role in making the decision. And I do believe that to better handle the pandemic, or let's say the epidemic, we should have investigate our local data and use that local data and convert it into policy and decision tool. On the next slide, it's basically the RCSI publication. So out of those 31, we have done 20 publication. And the last slide, Laura, if you can comment, those are yes, so those are my final. This is my final slide, and just illustrate all the aspects that we have covered in our research area. The team has a copy of all the Bahrain data. Will be more than delighted and happy to share it with you upon request. And I think with that, Dr. Eman, I'll hand it over to you. Thank you very much.
Thank you so much, Professor Qahtani, for this very important and informative topic, and thank you for sharing Bahrain's data with us today. To all the attendees, thank you for joining us. And if you've got any question that you'd like to ask Professor Qahtani, he'd be more than happy to answer. So if you can drop your question, the Q&A section, and we'll be receiving your question. And at this point, Professor Qahtani, I would like to congratulate you and Bahrain on the study which has been published regarding COVID-19, and it was ranked among the top 100 scientific reports in the UK. I think it's been circulating around the news for the past day, so congratulations.
Thank you very much.
So I see there are 2 questions here at the moment, and please, if you have any questions, please feel happy to drop it in. So the first question, Prof. Manaf, is from Abdurrahman. It says, from the Gulf nations, do you think that Bahrain had the best approach in containing the pandemic?
Well, I wouldn't say it was the best approach. Each country has its unique measures. Again, we're not here to compare countries, rather than share the different tools that we have used. Most of the GCC countries, I think they have used similar tools. The only differences is maybe the preparedness when it comes for testing, the applying of antigen tests, different platforms, initiation of additional doses. Again, key things in Bahrain we have done back in May when we had the Delta, the heterologous vaccination. Bahrain was the first country that submitted a report to the SAGE, which is part of the WHO, to compare heterologous versus homologous. And what do I mean by heterologous? Is when you combine different platforms of the vaccine. So remember, we had initially of the Bahraini population, majority have taken the inactivated, where we give them additional dose with a messenger mRNA, and we compare that with those who had the homologous, for example, Pfizer or Sinopharm, and we have seen heterologous vaccine. It actually improved your neutralizing activity up to 98%. You boost your neutralizing antibodies. So I think it's a different tools and different measures, but most of the countries, I think, have handled the pandemic at different stages. And again, we're here just to kind of learn and exchange the different ideas amongst us.
Thank you, Prof. Manaf. And the other question is, they're asking, when can we say that the pandemic is over?
Well, as I said, remember, 56% of the developed world has been fully vaccinated. When you go to the underdeveloped world, unfortunately, there are only 13%. Most of the variant kind of comes from countries that they have low vaccine rate. Can you believe it? There are countries now in the world have not received a single dose, even though it has been more than 2 years of the pandemic. So when you have high transmission of the cases, and it's not secret, Europe, for example, Asia now having a surge of cases, and unfortunately, UK, for example, having a surge of cases and hospitalization as well. So when you have the transmission, Dr. Eman, of the virus high, when you have variant that is very transmissible, and the vaccine, which is less than 70% to be for the world to be vaccinated, whether or let's say having the immunity from the vaccine or from the natural infection, It's unfortunately it's not even close to be endemic, and I think even WHO have stated that very clearly in their media brief several days ago, and they keep saying this. There are certain I just remember one key things here. If you want to define endemic, for example, you can define by different key factors, either based on society, or based on individuals, or based on economy. So if you can run your businesses, for example, up to the normal standard, then you can say, and you don't have higher rate of hospitalization, then you can say you are reaching your endemic. If you are reaching a stage where and this is at individual level, where you have 80% of people have been vaccinated or naturally acquired infections, so they're immune protected, and you have the lowest hospitalization again, you don't have pressure on your healthcare, you can safely say that you are reaching to the endemic. But to have a state to say for the whole world we are reaching the endemic, that's unfortunately too far.
Thank you, Prof. Manaf. I think that's the last. Okay, so now we have another question that popped in. Which vaccine is most recommended, knowing there is still chances of more variants to arise in the future for young and elderly? Is there a recommended vaccine brand?
All right, so all the vaccines at the moment from the different platforms, they worked very well in triggering your T cells, which basically to prevent you from hospitalization and from death. The only variation that we have noticed from Bahrain since we have the different platforms is when it comes for the inactivated, for the elderly and immunocompromised, the efficacy of that will wane. And again, that's very well known for inactive vaccine. Not more than 6 months or 9 months of it will wean off. So that's why you need to have additional, and this is to minimize hospitalization and death, and this is not from infection. But when it comes for the viral vector and messenger mRNA, they're all equally effective. Messenger mRNA, one of the advantage of it is that it has a very high T cell response, and this is based on one of the team, Sean Crotty. He's the top world leader when it comes to immunology, and he published in Nature Moderna versus Pfizer when it comes for T cell, and both showed to have a higher efficacy. Qatar as well have a very good data published in New England Journal. I just seen that lately, and again, it showed a great efficacy when it comes for protection against hospitalization and death with 3 doses of the vaccine.
Dr. Prof. Manaf, I think we'll have 5 minutes left, so probably this will be the last question we'll be receiving. And says, what are the main reasons that the pandemic measures are coming to an end?
Sorry, what are?
What are the main reasons that the pandemic measures are coming to an end?
All right, so as if you recall, I have said it, you need to have the whole world has to reach above 60 to 70% of the vaccine, and I think that's what Dr. Tedros, the WHO director, have said. To end this pandemic, we need to reach up to 70%, and again, that comes from the scientists and epidemiologists. This is to stop the emerging of variant. SARS-CoV-2 is an RNA virus, highly mutated virus, and when you have this features of the virus and you have highly transmissible, I think it's important that we need to reach to the herd immunity level, and whether you want to agree by vaccine or by natural infection, 70%, and also that has been concurred by Anthony Fauci. He said the pandemic will be over if we reach by 70% of the people to be vaccinated or immune protected.
So I think we're going to call this as an end of the session. So thank you, Prof. Manaf Alqahtani, for your speak tonight, and I'd like to thank all the organizers in RCSI Dublin and Bahrain for your hard work and effort to make this a successful event, and I hope you all have a great evening. Thank you very much. Thank you for all the attendees who were with us tonight.
All right, bye-bye. Take care.
Bye-bye. You too.